Good morning, everyone. I am Chelsea Andrews, Executive Director for Everyone Home. Thank you so much for joining us this morning for this important discussion with Dr. Clanon in regards to how the vaccination plan rollout will happen for the community that we recognize as being one of the most vulnerable communities, those experiencing homelessness. In addition to joining us this morning, I want to pause and thank you all for the work that you've done as frontline workers and/or individuals that are supporting our frontline workers, helping our community. Today, we're going to go through a couple of just housekeeping points before we get into the discussion with Dr. Clanon. Dorcas, can you switch the slide? All right. So housekeeping points we'll go over first, then there will be a presentation by Dr. Clanon and an opportunity for questions and answers and some closing remarks. Just very few key points. One, if you haven't noticed already, you're automatically muted. That's because we actually have a fantastic turnout today, and we want to ensure that there are no challenges with regards to hearing this important content. So everyone will be muted. However, you will have the ability to put questions or comments in the chat. The meeting is being recorded because we'd like to have an opportunity to share this broadcast with others in the future. And we'd ask that you just hold off on typing any questions that you may have until Dr. Clanon has had an opportunity to go through her full presentation. So I'm honored to introduce everyone to Dr. Clanon. Dr. Clanon is a clinician, educator, program director, and medical administrator specializing in improving healthcare of low-income people. She is the primary doctor of over 100 individuals with HIV practicing at Highland Hospital in Oakland. She helped start and grow multidisciplinary HIV prevention and care programs in Alameda County, California, that have served thousands of people. She was the clinical director for the Pacific AIDS Education and Training Center, based at UCSF from 2001 to 2012, where she provided the clinical leadership for a 5-state program for teaching and coaching clinicians on HIV care and on quality management. She teaches and consults on quality management for the federally funded National Quality Center, including working with many small and large clinical sites in the states of California, Texas, and Michigan, and most recently, Laos. Dr. Clanon is the medical director and COVID-19 shelter and surge planning director for the Healthcare Services Agency of Alameda County, and the designer and lead for the county's $140 million whole person care pilot program, linking health and housing. She is a true servant leader in our community and has risen to the occasion. She quickly responded to our outreach efforts to ask her to join us today, and I consider her a true friend of ours. She truly understands and gets it as it pertains to the importance of prioritizing the community that we serve, those who are most vulnerable and have not been able to have an opportunity to stay at home during this most important crisis. Thank you, Dr. Clanon, for joining us today. We look forward to engaging with you and hearing the information that you'll share with us.
Thank you, Chelsea, so much for that. So, Dorcas, let's go ahead to the next slide. So I had a chance to talk with Chelsea a little bit a week or so ago, just to get some sense of what people would likely want to hear about. And I do want to do a little bit of background setting before we launch into the details of exactly what the plan is, although I know that mostly people are really focused on what is the plan. So first we're going to talk about what is out there now, what we've been doing during this year of COVID for making sure that, for making sure that people who are unhoused or in shelters are safe. Just a little bit of that background. And then I do want to go through some vaccine 101. We know that a lot of people are hesitant about taking vaccines, And I want you to feel equipped with the facts that seem to be, at least to me, to be persuasive, so that as you're having conversations with people, there's some guidance there, or some facts that you have at your fingertips about things that may help people make their decision. Then basics in Alameda County of vaccination, and then what we're doing already in terms of vaccinating people experiencing homelessness, what we're planning in the next month or so, and then a few challenges still to be resolved. So there's about 40 slides, so that should take about 40 minutes, and then we'll have a chunk of time to be able to go through questions. Next one, Dorcas. And one more. So I just wanted, this is just a shout out for my Healthcare for the Homeless team, who have done just an astonishing amount of work with all of you, in partnership with all of you in this past year, pivoting to be able to serve people having the twin emergencies, the twin catastrophes, really, of COVID and of homelessness. Next one. There are, from the beginning, starting back in February and March, there were prevention efforts that team put in place and worked with all of you on in terms of how to prepare your shelter to help keep people safe, what to do if there's an outbreak, and also going into encampments to talk with people about how they could keep themselves safe. There's actually a lot of organizing that people did within their curbside communities to keep themselves safe and work out ways of protection. And actually, between us all, I'm really proud to say that we have had a remarkable success in keeping the curbside communities and the shelters safe. Not that we haven't had outbreaks, but that the percentage of people who are experiencing homelessness who got COVID is actually lower than it is for most general community in Alameda County. So next one, just a couple of details about a few of those things. I think you all know that we have divided up the county into these different street health zones or work to have street health outreach teams working in combination with community health centers, that we have worked to divide up the county into these zones. And then these are the areas then where people have done multiple 400, 600 visits to shelters and to encampments over the past year in order to make sure people had protection supplies and other things that they needed in order to be safe. Next one. So just a little bit of looking back in terms of the numbers. So as of the beginning of this month, we knew that there had for sure been 280 people experiencing homelessness who have been confirmed to be COVID positive and either sheltered or unsheltered. You can see there the breakdown in terms of in which categories, and then another 327 people where there was some question about whether or not they were homeless, or they may be doubled up. And you can see there the little tiny graph underneath shows you kind of which months over the course of last year and into January of this year, as we saw. It started out slow, and then we did see a surge in December and January as the rest of the county did. But these are the people that we are certain that we are investigating who definitely had COVID. On the right-hand side is the hard work that's being done by David Motorsbach and Carrie Jennings-Perriott, people that I think are probably very familiar to many of you, in terms of the operations responding to outbreaks. In addition to the prevention efforts, to the 2 weekly calls that many of you participate in, which are continuing, then there have been many responses to encampment outbreaks. At present, we only have 6 active sites, which is great, and then 47 recent sites that were just recently closed. And then in terms of the shelter response, that's Carrie's kind of primary area. There are currently 15 active sites that we're following, meaning that there has been at least one person positive in the shelter, and then 100 different sites in which we have closed efforts. So there's been a great deal of work done here. And in addition to the mobile testing at shelters and other locations, and testing in encampments, which has been done by many of you and our partners. Next one. and this just shows you, this is actually, I think, last updated in August. And you can just see there the number of different, each of those red dots indicates a street health team doing outreach to an encampment location, someplace across the county. So there's a lot of this effort going out. We have a lot of capacity to be able to connect with people. Next one, Dorcas. You all know that one thing that we did together very rapidly that I'm very proud of was put together the Safer Ground and Operation Comfort programs in March. Those stood up very rapidly, and we were able to get a lot of people out of congregate shelter in order to keep them safe. And then now are able to actually augment our permanent supportive housing stock and our transitional housing stock. And looks like we have support to be able to keep them for a number more months. And that has really been, having that resource has really been helpful in terms of being able to, especially to address people's medical issues in addition to, the 300 plus people that have been able to find safe and stable housing as they moved out of Safer Ground. Next one. All right, so let's talk vaccine. Some of this will be very familiar to some of you, so I hope if you could be listening to it with an ear toward how would you discuss it with a client or a friend who was feeling hesitant or feeling that the vaccine wasn't safe, and thinking through whether you think these are arguments or facts that might be helpful to people in decision making. So next one, Dorcas. First thing is just to know that vaccines are not, they're actually fairly old as a public health intervention. They've been around now for a couple of centuries. Is that true? Yes, a couple centuries. And they do work. Over there, the big bubbles that are in the middle of the slide, those represent cases in the year 1900 of these different serious and in many cases lethal illnesses that are all preventable by vaccine. And now compared on the right, the U.S. population is actually much larger than it was in 1900. But as you see, numbers of cases of those illnesses has dropped to very, very, very small numbers. So vaccines have been around. We've used them for a long time to prevent illnesses, and they do it very effectively. Next one, Dorcas. So how do they work? Essentially, the vaccines, they teach your body how to recognize a piece of an invading germ, usually a virus, and they don't cause an infection, but they simulate a mild infection. Your body recognizes this invader that the vaccine is kind of holding up, and then ramps up its factory, its infection response factory, making antibodies, T cells, other cells that will respond then to an infection. And then, so when your body, ramps up, it is responding to this fake, non-infection caused by the vaccine. But then your body has now learned, and it will retain the ability, the memory, to be able to produce those antibodies now very quickly if the actual virus comes toward you or infects the body. Some vaccines require multiple doses in order to get people really immune. In traditional vaccines, which many of you have had, there's actually either a dead or broken up virus that's used, that's attenuated, or a live virus that has been crippled, that is injected into the body so that it cannot establish an infection, but it's actually pieces of the virus itself. The two vaccines that are two of the vaccines currently approved, we just got one approved on Friday, yay, are a new way of making vaccines. The mRNA viruses, they actually they never have been part of a virus. They were just made in a laboratory test tube, and it's just a little harmless piece of protein that your body recognizes as being a simulated infection and can use to produce antibodies. But then the mRNA vaccine actually clears your body within a day. Next one is a little more detail on that issue particularly. So I think people know that these are the first, that the Pfizer and the Moderna vaccines that were approved back in late November are the first vaccines that have been approved for people that have this new kind of mRNA technology. They've been around for a while under investigation and have been used, in animal settings. But these were the first two that were tested out in humans. And the thing that is so exciting about them is they get really, really good results, and they're super safe because they never came from a virus. So we know exactly what's in it because we made it ourselves in a test tube. So the mRNA looks like it's a little genetic instruction for the spike protein. When you see the coronavirus pictures, it has all these little spikes on it. So the mRNA codes for making antibodies against that spike protein. And then your body destroys mRNA, usually within a day. The cells, then they hold on to the little pieces that they made. The body, this triggers the immune response. Just for a couple of things, the mRNA does not go into your body's cell, the nucleus of your cells. It doesn't affect our DNA. It can't do that. And it also cannot give anybody COVID unless if there's any question about that, because it actually is never been part of a virus. So it's not, and as I said down there, it's not an unknown technology. We actually have been working with it now for almost 10 years. So next one. So I think this is the thing that makes people maybe the most worried is how did this vaccine get made so quickly? Few things. One of them is that there was already a clinical trial network. A lot of people are interested in COVID, and many tens of thousands of people are already there saying, raising their hands saying, I'd be happy to be a guinea pig in this trial. So that helped a lot. Usually it takes a long time to recruit enough interested people to get a trial together. Second thing was a big gamble on the part of our federal government and a couple of other governments that said, we don't know whether you're going to come up with something that will work, but we're gambling that you will. So we will tell you, go ahead and build the factory to make many millions of doses. Build your factories now, even before we know if it's going to work or not. That was a gamble. If it had not worked out, they'd have had to, billions of dollars in vaccine manufacturing capacity would have had to be junked. But we won that bet. And so normally the vaccine manufacturers wait to start any kind of building like that until they get approval. And that shortened things a lot, having those steps happen simultaneously. Also, the mRNA vaccines are faster to make than traditional vaccines, which is good. And they're easy to modify, by the way, in order to respond to things like variants that we're seeing now. And then last but not least, FDA, CDC, everybody else, anything COVID got shoved to the front of the line. So did not wait, behind all kinds of other things that were in line. Anything COVID, and especially COVID vaccine, got an immediate usher right up to the velvet rope and onto the docket of the FDA panels. So all of those things actually were, part of why there was such an accelerated ability to get these vaccine out and to market. Next one. So one thing that people want to know about is, were people like me, people from my racial or ethnic group included in these? How do I know if it was really tested out on people who look like me? I don't have a slide yet for the Janssen vaccine that was just approved on Friday, but just going back to the point at which the Pfizer and Moderna vaccines, you can see there how many, tens of thousands of people were enrolled and where those different clinical sites were. And then the percentages of people. There were significant percentages of people who were Latinx and African American, and also significant numbers of people who are age 45 and older. As people may know, these two vaccines had not yet been tested in children, and so they're not approved for children. But those things are actually going on now. They're recruiting and working on trials for children who are under age 16. So next one. Just a couple of things about the findings. I'm going to talk separately about the Janssen vaccine. So they both had extremely high efficacy. And what that means is that of 20 people who got this vaccine, 19 of them showed that they were not able to become sick from the virus, that there were no hospitalizations, no deaths, and no serious illness among the 95% of the folks. 5% of the folks did not achieve complete protection. And that's actually really good numbers for a vaccine. Normally, we're happy if we get up into the 70% range in terms of efficacy. So these are very high. Definitely causes side effects. If people have gotten vaccinated, you can talk about that. Your arm hurts that, the night or day after, some chills, a little bit of headache. It's definitely more than a normal, say, a flu shot. And what I tell people is you'll know that it's working because that means your body is really using it to respond. There was an initial concern about anaphylactic shock. There was a little cluster of those in Britain. It's looking like that's pretty rare, one in 100,000. Not unexpected in certain ways, but as long as people have an EpiPen with them, then the guidance at this point is people can go ahead and be vaccinated. So one thing people ask a lot of questions about, do we know this or do we know that about the vaccines? And I'm going to talk more about that in a second, but it is important to remember they've been around now really, in a significant number of humans since like August of last year. So we haven't had a whole year even to look at, how long it lasts. That's the question I think that is most in people's minds. Next one. So what do we know that the vaccines can do for us? We know it's very clear that it can reduce the number of people who are suffering with COVID. They clearly reduce the severity of disease, which we know because hospitalizations and deaths are significantly down. They can produce herd immunity. We can talk about that if people want to know what it is. And no question that they will shorten the length of the pandemic. And if we did not have vaccines. A couple of questions that are still out there. I mentioned we don't know for sure how long the immunity will last. I will tell you that nobody likes to go beyond the science. We're really saying, this virus has been very humbling to us as medical professionals, and it delights in embarrassing us after we say stuff. So people don't want to get beyond the science, but it is certainly likely, given the very high efficacy numbers, that it will last. People won't need to get revaccinated, in order to have durable immunity. And then in terms of transmission, so this, I think people are like, well, it doesn't seem to make sense. Why wouldn't the vaccine do this? So it's because in the vaccine trials, what they were looking for is, does it prevent death? Does it prevent hospitalization? Does it prevent people getting sick? Those were the data that were brought in order to get those vaccines approved. They also are collecting data on whether it looks like it prevents transmission. But it's possible, we haven't ruled it out yet, that the vaccine keeps you safe as a person, that COVID is not going to hurt you, but it doesn't prevent you from being colonized with the virus in a way that you could actually give it to others potentially, even though you're protected against it causing you to be hospitalized or hurt. So most people believe that a vaccine that's this efficacious will have an impact on transmission. It's a viral load thing, which we know in the HIV world, basically, if you reduce the viral load, you're going to reduce transmission. So it's the same sort of argument, but that's why you'll still see the advice being to continue to wear masks. It's not to protect you as a human. Once you're vaccinated, you're pretty safe. It's to prevent you potentially being colonized and passing it on to others. So next one, Dorcas. I'm really excited about this, that we're able to see in our community as in other places that the vaccine in real life is working. So you know that we vaccinated a lot of folks in long-term care facilities, all kinds. Skilled nursing facilities were the first ones, but also different kinds of, mom and pop board and care homes and lots of other places where people are living. Actually, there's the Alameda County Behavioral Health team under Dr. Chapman. They have a little visiting vaccinator team, and they've been going to residences for, taking care of people with severe mental illness and vaccinating staff and residents in those locations. So there's a lot of work that's been going on in those congregate living settings. So as you can see here, in the facilities that got all the way through with vaccines, some of them are still waiting their second dose, but there's overall been a 74% decline in the number of deaths that we've seen in long-term care facilities in the first month and a half of 2021 compared to 2020. And since the beginning of the year, only 10 people have been hospitalized, and only two have passed away in 2021. And you can see there the number of people who were hospitalized and the number who passed last year. It was almost one a day. So this, to me, clearly shows that this is also true that surge is dying off, which is good. The surge is going away. But to me, this shows that that places where we invest in vaccination, we see decreased deaths and hospitalizations, which is what we would expect to see. Next one. So let's talk a little bit, these are the last couple slides in the Vaccine 101. So people probably heard of this. This is sometimes also called the Johnson & Johnson vaccine, the Janssen vaccine. It was just approved Friday at the federal level. And we're told that a lot of it has already been made and will start shipping very soon. The reason why it's particularly of interest for us is because it's a single dose vaccine. It also doesn't require the fancy ultra low temperature freezer that the Pfizer does. And it's less expensive we don't have to purchase the vaccine, but we do have to purchase all the stuff that goes into taking care of the vaccine. And so when there's less of that, then it costs less money. So the idea, of course, is, well, who could we reserve those single shot regimens for whom it's just going to be really, really, really tough to come back and get a second dose. So the kicker here, though, the complication, next slide, Dorcas, is that this concern about efficacy and equity. So this vaccine is reported to be 66% effective, as opposed to the 95% effective of the other two within 28 days of the single vaccination. And then 85% effective in preventing severe COVID. So there is, we did see that when people got through 28 full days after their vaccination with the single shot, that we didn't see any hospitalizations or deaths in the study in the group who got it. And there was never a head-to-head study where we compared one vaccine against the other vaccine. So the fact that the numbers lower, 66% and 85 as opposed to 95, that could mean it was going up against a tougher vaccine, a tougher virus, because we have seen the virus is evolving, or it could mean different people who had a tougher time developing antibody response. We're not exactly sure. But what this means then is that, I think what we've been thinking about is for people experiencing homelessness, people who are being incarcerated for a short period of time, and people who are admitted to a hospital and going home, who will not, who are ill and will not be able to easily get back for a second shot of vaccine. Those are kind of the groups that we're thinking about. And we just need to make sure that we talk to people about the fact that there's a choice here and help people make a choice. You want to be vaccinated. What do we would rather than give you an incomplete dose, one dose, have you just get one dose of a 2-dose regimen that's not going to protect you well. Would it be better for you to get a single dose of this other, of this vaccine that's designed in that way? I'm interested in how people think we should kind of talk with people about that. We have not, in general, offered people a choice about which vaccine they get, because we just don't have enough to do that with. But this is a place where I think we're feeling like it's probably not okay to just give people the choice of the new vaccine, but instead to have a conversation with them about what they think will work for them in their lives. Next one. Okay, so what about in Alameda County? How am I doing here? So this is on our vaccine website. You can look up in the upper left-hand corner there, that's 312,000 is the number of vaccine doses that have been administered to people who are residents of Alameda County. And then below that, the 232,000, that's number of first doses. So that's a pretty reliable number of Alameda County residents who've been vaccinated. That doesn't mean that the county vaccinated them all. In fact, because we're vaccinating people where they work, if they're healthcare workers, we're vaccinating a bunch of people in our county who live in Solano, and they're probably vaccinating a bunch of our guys. But it does mean that this is our best estimate. They're just there are about 1.4 million Alameda County residents who are adults So, this is something on the order of 1/8 of the way there, or something like that. We look at the next slide, it actually translates this into some percentages. So you can see there about 17 or 18% of folks have actually managed to get a first dose, and then just a small number so far have been able to actually complete their second dose. You can see there, and all these slides can be sent out. You can kind of see something about where people are living, the racial and ethnic breakdown, and then also the age breakdown in terms of who's been vaccinating. Next one. And then this is something that we track very carefully and has really been difficult during the vaccine. So on the left-hand side is from that state data I was just showing you, is the racial and ethnic background of people who have received doses of vaccine in Alameda County. And then on the right-hand side is people, 16 adults, and what the racial and ethnic breakdown is of all adults living in the county. And it shows that we are, under vaccinating Latinx and Black residents in particular, which is not surprising because we know everything that's ever been done on vaccine hesitancy shows that that's a group that needs a little longer to make the decision. And then also we started with healthcare workers based on the state's rules, and they tend to be a little more predominantly white and Asian. So this is our challenge. And all of the ways that work fast to get people really want vaccine fast, all the ways to get vaccine to people fast that the state government is facilitating are really anti-equity. Because when you make it easy for people to get appointments who have cars and computers, you have people sitting around all day with their computers who will snag an appointment and drive forever if they have to go get it. And that has really been a challenge, the tension between wanting to vaccinate a lot of people fast and wanting to make sure that everybody gets the chance to actually get vaccinated. The challenge reminds me a lot of when we first started to see highly active antiretroviral therapies back in the late 90s, that it was really hard to get, my African American patients, had these Tuskegee, memories and stories in their families and lots of other things that were pushing them away from receiving the treatment, and trying to talk people through what did they need, what would they need to see, what would be the trigger that would tell them it's time to start on treatment. It reminds me a lot of that same period. Next one. So I'm going to show you, getting down into some more details. I'm going to show you, this was the first version of the vaccine framework that came to us from the federal government. Set certain guidelines, these phases that you see down at the bottom, and then our state actually added a lot of division within those. So as you can see, it started out phase 1 with healthcare workers, and then people who either lived or worked in long-term care facilities. And then in phase 2, so after we vaccinate that group, in phase 2 is included there specifically staff and residents of homeless shelters and group homes. And we just were reading into that, that would also include unsheltered. That was a little bit of a stretch, but that was our plan. So this came out in, I want to say November, I think maybe is when we first started to see these. And this was our first plan. And then unfortunately, Dorcas, next one, unfortunately, we saw over and over again these plans being changed and thrown away. So where we are now, next one, Dorcas. This was the framework as of the end of January. And you can see there still in phase 1 healthcare workers, that didn't change a lot. So we worked our way all the way through that group. Actually, we were one of the first counties to vaccinate people homeless housing, people working in encampments and home health, and street health outreach workers. That was very exciting. Actually, we were able to do that in December, and that felt really good to be able to serve that community. But then you can see here that instead of the groups that we were looking at a minute ago that included incarcerated and people who are unhoused, et cetera, they're now showing up way down at the bottom of this phase 1B. And then a bunch of, people, anybody over age 65, and then workers in these very large groups: education, childcare, emergency services, and food and ag, which includes restaurant and grocery. And then on the 25th, the governor actually announced that we would be shifting, after we did this tier 1, age over 65, that we would be shifting then to age only, which would mean that there would be no special call out of people experiencing homelessness, and that we would just have to wait as they went through, as they went through different age bands. There was one more change that happened on the 1st, and then the governor announced another one over the weekend, which was that there will be a phase 1B tier 2. These names are very confusing to keep in your mind, but that will be people who are under age 65 but have significant comorbidities, physical conditions that put them more at risk for put them more at risk for COVID, bad outcomes for COVID. And again, that looks like it would all be in front, be before people experiencing homelessness. So given the shifting grounds here, we actually just made a decision in the public health department that we were going to vaccinate people who were in shelters first, because congregate settings are more risky, and then would be moving on to do the unsheltered. Technically, it's not in tier, but we sort of checked it out kind of a little bit with the state and said, we're planning to do this. Is this going to cause you heartburn? And it does not look like it will. So we're technically going off the roadmap to be able to do this, but there's very strong support, on the part of the health department and of our board for doing that. And we also, we have actually begun that as of a couple of weeks ago, vaccinating people experiencing homelessness, and also, since there is overlap, sometimes people at Santa Rita are now, incarcerated people at Santa Rita are now being offered vaccine also. So that's where they are. The names are confusing. Things have changed, so much over and over again that it's confusing even to us, and very easy it's very easy to understand why people who are just trying to follow it and understand when their turn is are really having a hard time. It's been very confusing. Next one, Dorcas. So just as for people who are wondering about that addition in terms of underlying medical conditions, so you can see there which illnesses they are, and then the developmental. Then you can see for people who have developmental or other severe high risk disability. And down below, it's going to be kind of hard to implement this structure, because there's no way for us to really know whether people have these illnesses or not, and you can't tell by looking. So, there's going to have to be some way to verify that people have that illness. We're still trying to figure that out, as are all the surrounding counties. Next one. So, vaccine supply, just so you know, we will get 17,690 first doses this week. There also are doses going to community clinics. There are doses going to Kaiser and to Sutter. So that's not the only doses, and then we have the Coliseum that are coming into the county, but that's how much are under our control. And we do these groups of people are very, very, very large that we're trying to vaccinate. People in that tier 1, that emergency services, teachers, et cetera group, and the people over 65 is about 325,000 people. There's 96,000 people in our county who are over 75. So just trying to figure out how to we're trying to gate, a certain number of doses to each of those populations each week. Rather than move through them and complete them one by one for equity reasons. Next one. These are the different ways that vaccines getting out there. There are these mega pods. There's one that we run at the Alameda County Fairgrounds. There's the one at the Coliseum currently that is run by the state and the federal government. And then we share, Berkeley really does the work, but we share a North County pod with Berkeley by giving them vaccine. And that one's at the Golden Gate Fields, parking lot at Golden Gate Fields. And each of those is at the several thousand a day. Coliseum actually is doing 6,000 a day. We are closing out a couple of pods that we used, St. Rose Hospital in Castro Valley, to vaccinate lots of healthcare workers, because we're pretty much done with them at this point. And what we plan is 6 community sites that are located in communities where we can actually limit the people who can come to that site by saying we're really doing outreach to people who live in this neighborhood to make sure those megapods will go on, and that'll be a great way for people and with cars and computers to get vaccinated. It works great if you have those things, but the community pods are our way to try to make sure, one of our ways to try to make sure that we're also getting to people for whom that's not a great way. They don't have a computer, or they're not sitting at home all day long able to go refresh. I was telling somebody the other day that trying to get an appointment at one of the megapods it's like trying to buy Beyonce tickets. You have to be right there. And if you miss your chance, then you have to wait till the next set of those appointments disappear really fast. We also have another really important equity distribution site for us is all of the community health centers, both the federally qualified health centers, including Davis Street and also Roots, are all vaccinating. Umoja is going to start vaccinating with us, and also La Familia. So there are different organizations that are doing these things, and they are doing a great job of targeting, in particular, people of color in the neighborhoods that are hardest hit. All of our hospitals are doing some vaccination, and then we have both the federal partnership with CVS and Walgreens to the long-term care facilities, but also we're partnering up with independent pharmacies based here in Oakland. And they go with some of our staff to long-term care facilities that are maybe that are in the neighborhoods that are hardest hit, those that have high percentages of Medi-Cal recipients who are living in them, places that have had lots of outbreaks. So we prioritize those for these visiting vaccinator things, we're calling them. We're also going now to senior housing, where we're working with Oakland Housing Authority. So visiting vaccinators will go to the residents. If there's a big room downstairs that works safely to get lots of people vaccinated, we use that. But if not, they'll actually go floor by floor and ask staff to help residents sit on a chair outside the door of their apartment or room. They get their vaccination, they get observed there as a group, and then staff helps them go back inside, and the team moves to the next floor. So that people only have to step outside their door. And if they can't do that, then the visiting vaccinators will go into their rooms or apartments to vaccinate them if they want it. There also are some for-profit vaccinators, Curatives, Color. There are other contract groups that we can contract with, and we're looking at that. We really want to have lots of different places that people can go. It is being made available now at CVS pharmacies. It's hard. You have to make an appointment on the computer, so it'll be a while before that's really available to people without cars and computers. But we want to have lots of opportunities for people to get vaccine. Next one. So just going to talk through a little bit. We did, as I mentioned, we did do the street outreach workers of various kinds in December, and also some shelter workers at that point. And now what's planning and underway is doing the shelter sites. Still a lot of challenges around how we're going to do mobile vax or transport people to sites for people who are unsheltered. And some of our usual difficulties there is getting people to leave the site to get care versus bringing care to them, and then ID requirements. I'll talk to you in a minute about why that's a challenge. Next one. So within Project Room Key, we have the Safer Ground and Comfort hotels. Actually, all staff and all the residents who wanted a vaccine have now received it. We started with them, starting with the over 65ers, January 22nd when they came in to tier, and then beginning with all guests, regardless of age, beginning on February 11th when we decided to prioritize people experiencing homelessness. So next one just has a little bit, just a couple of things about who got it. So 181 guests among the different hotels decided that they wanted to be vaccinated. So the current census is 497, as you see there. So that's about a third. We're hoping more people will opt in, over time when they see that the people who got the vaccine didn't turn purple and have their toes fall off or whatever. that, you know, people just don't always want to be the first ones, which is a very reasonable approach. So we're still hoping to be able to do another pass, and especially trying to talk with people about getting vaccinated before they would leave the hotel. Next one. So that's Project Room Key. That's already underway. And just a little bit there about the age bands. So about a third have been to residents over 65, which is, you know, that's good to know, because we want to make sure that we get good protection for those folks. And next one, Dorcas. Then by race and ethnicity. I think you guys probably know how to read these. This is the federal two question. So the first, ethnicity, are you Latinx or not? And so 12.7% of people said that they were Latino or Hispanic. And then I think the ones that the green bars are fairly self-explanatory. So definitely more white people, a disproportionate number of white people are comfortable receiving the vaccine. And you know, especially we're worried about the Latinx and African Americans because of their disproportionate impact. Okay, so just a little, that's what we know a little bit. I wanted you guys to see those numbers because I think it probably represents what we're going to see in terms of people who are eager, people who say yes right away and know that they want it, versus people who are going to need to have questions answered, or just, you know, are going to need to take a little longer before they'll feel comfortable. Next one. So what we're looking at is mobile vax at the shelters and transitional housing locations, using partnerships with the pharmacies, and then also healthcare for the homeless. And I mentioned behavioral health. Healthcare for the homeless, both the county-based team and also the Alameda Health System-based team. Let's go to the next one. So they are doing pilots this week. St. Vincent de Paul on March 4th, and we're trying to vaccinate there 100 to 200 people. And then EOCP, about 50 vaccinations were done there. I believe that already happened over the weekend. I could be wrong. But this will launch, you know, going out to the shelters, and it will be staff and residents. What we will ask your help for during those is, just as when there's a testing event, if testing is coming, that you have a chance to talk with people the day before, have a sense of who is likely to be interested, and then just help them to get into line, help make it efficient, so we can, get lots of people done, and not have people waiting in long lines, but be able to help people move quickly through it. And mostly though, just to be, familiar faces for people who are living in the shelter to answer their questions, and to make sure that they know that this isn't their only chance. We'll be back. And we really want them to say yes when they're ready to say yes. But we want people to say yes. So next one. Then the street health. Oh, so I can show you quickly the schedules for March. We have, I think I totaled them up between Alameda Health System and the pharmacies and healthcare for the homeless. It looked like we had about 36 vaccine vaccine clinics planned for the month of March. So it's going to be busy. There's going to be one happening somewhere 6 days a week, basically throughout March, once we get it revved up. So we of course will be coming back for the second doses unless we have Janssen. So it's going to be a busy couple of months, as we'll be doing a lot of moving around the landscape, making sure that we're able to take care of people where they are. So the challenges of the street of encampment-based or unsheltered is that the vaccine itself, the vaccines that we have now require they're fiddly. Once you take the Pfizer one out of its ultra low freezer, you have 5 days to use it. There's 1,000 doses, essentially 1,070 doses, 1,170 doses in each tray. And once you puncture a vial, if you take one dose out of a vial that has 6 doses in it, then you have to use up the rest of those doses. So, the concern is we know that we're not going to get high uptake in encampments right off, that there maybe be a few people who are leaders or just who are more comfortable with it, or who have heard about it from their friends or something, that'll say yes in the beginning. But what we're worried about is making sure that we're not wasting vaccine, because that's liquid gold. So we want to make sure that we have it planned. So we can go, we can, meet people at the encampment. We can bring the vaccine there and back safely, so the vaccine isn't wasted. And we can, offer people where they are living that support. Pardon me. And then we also are working with our street teams, the 14 zones that I talked to you about, they all are connected to a community health center. So, going to be leaning on them to actually learn some about this, with the help of our vaccine team at the public health department to, either draw up individual doses and be able to dispatch people, to do vaccine and come back, or, exactly how we do what's called the cold chain, the protection of the vaccine. So I think that is it in terms of my slides. Oh, I just wanted to show you, this actually happened. It's not photoshopped. This was the first day at the pod, the mass pod at the fairgrounds. And it just made me it's such a gorgeous picture. And it just made me want to say that, there's been a lot about this year that's just been incredibly hard, incredibly sad and devastating. It's just been such a catastrophe for our whole community. And vaccine, of all the different things that I've been part of, vaccine is the thing that actually makes me feel like this. It makes me feel hopeful. I really believe that it is safe. I believe it blood and bone, heart and brain, that it is safe for people and that it brings people into safety from COVID. And if you've participated in a vaccination pod, you see that it's very emotional. People cry, they fist pump, tons of people take a selfie, to share with their families, to let them know that they're halfway to safety, or if it's their second dose. So it's been very difficult because of all the changes and how hard it is to make sure that the people we care about are in line for this vaccine too. It's been hard, but it's also been extraordinarily joyful. So let me stop there and got just the attachment, the connections to our website. But Chelsea, I don't know if you want to take the slides down and just see people and do questions. How do you want to do the next piece?
Absolutely.